Here is your question. Right. So if you have read and understood, considering it's surgical and not anesthesia, kindly tell me what are you looking at in these two pictures?
These are the medial and lateral surface of the bones of the left foot.
Yes. Okay. Would you be able to identify, yes, number one?
It's tubercle of the anterior part of calcaneum.
Okay. What are the bones of the foot? What bones or which bones form the foot?
There are 7 tarsal joints, then 5 metatarsals and phalanges.
Yes.
For the tarsals are calcaneum, talus, cuneiform, navicular, and cuboid.
Okay. Can you please tell me what is this in picture B? What is this 19?
This is sinus tali, or
Yes.
talar sinus.
What is the tarsal sinus?
It's a sinus, or it's a. Sorry, Pam, I would like to come to it later.
Okay. How many cuneiform bones are there?
3 bones.
Yes.
Medial, intermediate, and lateral.
Yes. Okay. What's the characteristic of a navicular bone, and which one is that? If you can tell me.
So, 16, number 16 is the navicular bone, and it has navicular tuberosity.
It's 15.
Oh, sorry,
Okay.
15.
Yes. So what is the characteristic of navicular bone? How is it different?
It has navicular tuberosity, and there is attachment of first deltoid ligament.
So what is deltoid ligament?
It's deltoid ligament is a triangular ligament in medial part of ankle joint. It has 4 parts.
Yes.
And it arises, or its proximal attachment is to the medial malleolus.
Yes.
And distally it is attached to navicular tuberosity, neck and body of talus, sustentaculum tali, and
Yes.
spring ligament.
Yes. And body of talus, neck of talus. Yes, 4 or 5 points. Okay. Can you please tell me how many arches there are in the foot?
There are 3 arches.
Yes.
Medial and lateral longitudinal and transverse arch.
Yes. Okay. Can you please tell me the components of the medial longitudinal arch?
It's bony, muscular, and ligaments.
Yes.
Bony is calcaneum, talus, navicular, cuboid, navicular, cuniform, and
yes, all 3 cuneiform. Yes.
Cuneiforms and 3 metatarsals.
Yes. And what ligaments and muscles are attached there?
It has interosseous and spring ligaments, and muscles are tibialis anterior, tibialis posterior, flexor digitorum longus, and flexor hallucis longus.
Flexor hallucis longus and perennius longus. Okay, good. Can you tell me the attachment of flexor hallucis longus muscle?
Flexor hallucis arises from middle anterior and part of the fibula and interosseous part, and it is inserted into the distal phalanx, dorsal aspect, the great toe.
Okay. Can you please tell me how many joints there are in the foot?
There are three main joints:
Yes.
ankle subtalar joint and Chopard's joint. Apart
Yes.
from that, there are tarso-metatarsal and metatarso-phalangeal joints.
All right. How this subtalar joint is articulated or formed?
It is formed between the upper part of the calcaneum and the talus. It is ball and socket type of joint.
Yes. Yes. And what are the movements which are possible at this joint?
Eversion and inversion.
Possible. Very good. Okay. Can you please tell me what you understand by the term mid-tarsal joint of Chopard?
It's a compound joint formed by transverse alignment of two joints.
Yes.
It is calcaneocuboid and talo-navicular joint.
Yes.
And
So what are the movements that take place at this joint?
it's usually slight abduction, adduction, or gliding movements that occur.
Okay.
And circumduction.
What are the, okay, in which position this ankle joint is most stable?
In dorsiflexion, because the anterior surface, anterior part of the talus is wide. So when there is dorsiflexion, it fits exactly into the tibial articulating surface.
Yes.
And in plantar flexion, the narrow posterior part has more range of movement because of extra space.
Okay. Can you please tell me what is the surface anatomy? Where would you palpate arteria dorsalis pedis?
In the first web space, just lateral to the tendon of extensor hallucis longus tendon.
Yes. Okay, good. Can you tell me, all right, okay, can you also tell me where would you feel the pulse of posterior tibial artery?
It's between the posterior border of the medial malleolus and midway between posterior border of medial malleolus and tendoachilles, or 2 to 3 centimeters below and behind medial malleolus.
Can you identify structure 6 in picture C, please?
It's the deltoid ligament.
Okay. 26, please.
It's a navicular tuberosity.
18, please, in picture C.
Spring ligament.
Okay. Right. Can you also identify in picture D1?
So anterior talofibular ligament.
3, please.
Calcaneofibular ligament.
Yes, very good. Okay, moving on to picture E. Can you identify 3 again, please?
Yes, it's a calcaneofibular ligament.
Good. Right, 19, please.
It's talofibular ligament, posterior talofibular ligament.
Very good. Okay. Can you please tell me what are you looking at?
It's a gross specimen of dorsum of the right foot.
Very good. Okay. Can you tell me about the arches of the foot?
The foot is supplied by mainly dorsal aspect is supplied by dorsalis pedis artery, which is continuation of anterior tibial artery, and it lies just lateral to extensor hallucis longus, and it passes on the talus cuneiform and first metatarsal, and in between the two heads of first interosseous muscle, it goes deep to form deep plantar artery, which communicates with the lateral plantar artery to form plantar arch.
Okay. Can you tell me how? Tell me about the course of the arteria dorsalis pedis.
Yes, ma'am. Just below extensor retinaculum.
Yes.
It lies just lateral to the extensor hallucis longus.
Yes.
And in between the tendons of extensor digitorum, and then
it's the continuation of which vessel?
Tibialis, anterior tibial artery.
Yes. Okay. And then how it ends?
It ends by giving deep branch into the dorsal, into the plantar surface, which communicates with the lateral plantar artery to form plantar arch.
Can you please tell me quickly how the Achilles tendon is formed?
It's formed by from the muscles of plantaris, soleus, and gastrocnemius.
All right, good. Yes. Can you, in this image that I asked you, if you can identify number 7, please?
It's extensor hallucis longus.
Very good. If you can please identify 6 here.
Extensor hallucis brevis.
Very good. Okay, and if you can identify 12 here at the bottom on the right hand side.
So peroneus tertius.
Yes, very good. It's peroneus tertius. Would you be able to identify tibialis anterior here? Which number would that be?
Sorry, ma'am, I couldn't get it.
It's 17.
No. Okay. Yes, ma'am. Tibialis anterior.
Okay, good. What is the nerve supply of tibialis anterior muscle?
So, a deep peroneal nerve.
Good. Very good. Excellent.